Hello, everyone, and welcome to the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Volodi. And as we have been doing now for many months, if not longer, it's your questions that drive this podcast now moving forward. And we had a great question today. In fact, it's a question I get quite a bit, very often in clinic. A question about things that our friends and loved ones with Down syndrome will run into, particularly things along the lines of muscle tone in the mouth, drooling, issues that can come up. And this particular person had a question about their 3.5-year old who's been having some issues with drooling and difficulty keeping that mouth in a closed position. And so I put out an email and I said, "Hey, experts, who wants to come on the podcast and join me?" And sure enough, Kay Baumgardner, who is a speech and language pathologist in Minneapolis, is on the podcast with me today to address this question. So, Kay, before we go right into the question answer time, tell us a little bit about who you are, what you do, and why you love working with this population.
Hi, thank you. Yes, I am a speech language pathologist and a certified lactation counselor. I've been practicing for 32 years,
Yeah.
and most of that time has been working with children that need oral motor development, feeding, and communication skill work.
Okay.
Um, I love I've always loved working with this population. If I can work with a baby, that's my all-time favorite. But over the course of the years, I've been able to work with children, babies, teens, um, and just I'm amazed when I first started seeing so many clients. Um, I was surprised at how we could have five people the same age and pretty similar histories, and yet they're all so different. And I shouldn't be surprised by that, but I was, and it really opened my eyes. So I love seeing children gain new skills, and helping families really advocate for their child.
Wonderful. Yeah, that's great. Yeah, I too love babies, but I think that just comes with the territory of being a pediatrician as well. So to get a little bit more specific about this person's questions, the child is 3.5, but this symptoms really started around 3 months of age, and early intervention has been involved. And now that they're in the school age, the school age services are involved. And it sounds like this particular listener has tried multiple different angles to try to find somebody who can help with the drooling issues and the difficulty with keeping the mouth in a closed position. Let's start with that second half of it, the closed mouth position. This is something that, we do see in a lot of people with Down syndrome, I think for a variety of reasons. But what is your approach? And is there a need to manage anything when it comes to like that open mouth position, perhaps a little bit of a tongue
Mhm.
protrusion that we might see in some of our friends with Down syndrome? What's your approach?
Yeah, I I definitely see this, and the first thing I do with any child that comes into my office is we have to make sure they have a patent airway. So we have to make sure that they can breathe through their nose.
Mm-hmm.
Here in Minnesota, it, we kind of say, okay, between October and May, it's congestion season.
Yeah.
But if you can't breathe through your nose, then all the therapy in the world isn't going to help you. So first thing is we make sure I'll do exercises with the child to see if I can help to clear. Is there one side or the other? I'll have the family see an ENT to make sure that there isn't anything structural other than, we know that there's smaller facial structures, but is there anything else going on that can help potentially clear that airway? So once we've established that, then I'll work on um, their sensory system. And oftentimes the mouth is open, and their tongue is forward because they don't necessarily feel where their tongue is in their mouth. So their sensory system in the oral cavity tends to be weak. So they don't always feel where their mouth is, where their tongue is in their mouth. They don't feel if they have saliva pooling. Their tongue is forward at times because they might have enlarged tonsils or adenoids. And so then there isn't space for their tongue to rest in a more retracted position. So I will work with the child to determine, again, do we need to send to the ENT to look at tonsils and adenoids, or is are we just going to target some sensory activities to increase awareness? Because
of the position. Yeah.
right, so we really need to work on getting our tongue retracted, and we need to get lip closure. So working on lip closure through a variety of exercises, but drawing awareness with temperature, sensation, playing games with them. Everything should be fun. The more fun we can make it, the children tend to participate better.
Yeah, yeah, and definitely, I love how, the approach has to be that can they breathe with their mouth closed is it has to be the first step. And how many
Mm-hmm.
people do I see with, their adenoids or their tonsils are enlarged and they can't breathe any other way than through their mouth, and hence the mouth would remain open at those times.
Mm-hmm.
And I would encourage our listeners to go back to podcasts that we've done on sleep apnea in the past, and just the importance of staying up to date with those types of guidelines too, because even as they get older, the issues don't always necessarily just get better. So I appreciate your approach there. I don't know if it lends itself well to an audio style podcast, but what are some of the things you can do to help them sense their tongue position? Like what are things that you do to help with that?
Yeah, um, I'll use different tools. So
Hmm.
a lot of people know what a toothette. It's a stick that has a sponge. It's dry. So I might dip that in cold water on an ice cube, and we'll use that on the sides of the tongue, on the palate, um, on the gum, on the inner cheek, to help draw awareness to the different parts of the tongue. I'll use vibration, Z vibe, electric toothbrush. There's the Sensi. I mean, there's so many products out there today, but even for families, I try to think of things that they might have that they don't then have to use an extra expense. Um, Age appropriate, I'll start a gum chewing program where it helps them provide proprioceptive input, encourages lip closure, promotes tongue movement, stimulates saliva management, using ice chips. And they could be just ice, water, or if, a different flavor, cranberry, something that's a little tart to increase their awareness. Use a lot of touch cues if tolerated. I'll take their hands and use their hands just gently on my face or on a puppet or on a mirror. Just a lot of visual feedback has been really helpful.
Hmm. And just for my knowledge, what is it about increasing awareness of the space where the tongue exists? What is it about that makes them then want to keep it inside as opposed to, oh, that felt good. Let me stick my tongue out more to get more of those sensory things.
Mm-hmm.
What are some things that you do to encourage it to go in the mouth?
Yeah. So practicing. So once we do the stimulation, we call
Yes.
it, with the vibration and so forth, um, I might use a tongue depressor, and the child has to hold their lips together
Hmm.
and their tongue is back, and maybe we're humming a little tune. Mm-hmm.
Oh, I see.
Happy birthday, or something, longer and longer, anything by Miss Rachel these days. um, so it could be, um, I like to find out, do they like animals? So we might pretend, we're an animal and our lips are closed. Are we going to be, the dog or the cow? Or how would they close their lips and have different pictures?
Mm.
And just encouraging them, okay, our lips are closed. Can we touch our teeth? Are we
Uh-huh.
moving our tongue from side to side?
So certainly as they get older, some of those techniques that you're describing would be something that they could do obviously a lot easier as they got older. Yeah.
Right. And when they're infants, working with some of the younger patients, it's a lot of facial massage, working under on the mylohyoid, helping to just elevate the tongue. Again, making sure you can breathe through your nose, but a lot of facial massage and stimulation. Some techniques that Lori Overland shares in her trainings with children with Down syndrome. In her videos, she'll go over different techniques for the younger patients. But again, it's also just doing something over and over and over, trying to establish a habit. So in the 3-year-old, really making it fun with multiple attempts at, okay, our lips are closed, watch in the mirror. Can you put some sprinkle or lipstick with our, chapstick, but something that they might be interested in getting their lips closed so we can get that retraction.
Hmm. Okay. Yeah. And I'm assuming and maybe I'm wrong, but I'm assuming that the drooling concerns that this particular parent brought up is somehow connected to some of the things that we've been talking about in terms of the mouth being opened, or is there anything else from that perspective?
Yeah, I think the mouth being open, and then also I find that the children aren't always swallowing frequently enough.
Mm.
They're not feeling the saliva pool,
Hmm.
and it just runs out. So I'll work with different visual timers and cue a swallow. But it needs
Ah.
to be consistent. So it
Mhm.
can't just be a random, oh, we're going to work on it Monday, but not again till Friday. So when it's a certain concern, such as this mom, her question, it's something that we have a plan and there needs to be consistency, especially training a swallow. It has to be worked on several times a day, which can be daunting, but it doesn't always have to be that you're touching the child. It could be a cue across the room. Oh, touch your chin, touch
Uh-huh.
your neck. Oh, and try to get the verbal cue away, and maybe that it's just visual. So the
Okay.
least amount of cues that a child would understand are best.
And with your speech background, is is working on these things with a child with Down syndrome, is there any thought that it helps with speech production, expressive speech later in life?
Yeah, absolutely. So the more aware the child is of the articulators, their control of the tongue and lips and jaw definitely impact their speech production. Um, there's a great correlation between the sensory and the motor act of speech.
Hmm.
So they're always, you can't have one without the other. And I think incorporating that both elements into a therapy session as well as a home program really sets the child up for success.
And I would assume that this would be something that like a school-based speech therapist may not necessarily be focused on so much because it doesn't necessarily impact education. Would this be something that a family would maybe need to seek private therapies if they were able to get those?
Absolutely.
Okay.
I do know some schools, the therapists do have extra training.
Okay.
However, most, I would say, yes, it's probably better to work with a
Yeah.
private therapist.
Okay. Wow, this has been super helpful. I really appreciate it. Is there anything else on this topic that you want to make sure that we talk about today, or anything that you would say would be, a good kind of take-home point for our families today?
Yeah, I think mostly I would just emphasize how important it is to ensure a clear patent airway
Mhm.
before expecting your child to close their mouth for any extended period of time. That's number one. And ruling out anything structurally and being consistent.
Hmm.
Having shorter sessions, expecting, let's do this for 5 minutes and then we can do something else. But I think adding in some visuals, maybe a schedule that a child can follow helps to make their awareness and ability to follow along um, improved. But I would say the other piece of it is too is just continue to validate your persistence
Hmm.
and advocate for your child. And I think
Yeah.
it's wonderful that they're asking questions
Yeah.
and trying to get more information.
Great. Are there any resources that you're aware of on this topic? Anything that you would want to make sure I include in the show notes or anything like that?
Yeah, I do think that Talk Tools has some great resources. I get a lot of information from the Down Syndrome Education International um, and the National Down Syndrome Society. Those tend to be the three that I um, frequent the most for resources.
That's great.
Um, yeah,
So
yeah.
glad that I'm so glad that they've all been guests on this podcast in the past. So that's good. It validates that we're getting the right people on the podcast too.
Yeah, yeah. And I think too, I would just, another thing that just came to mind, but for parents specifically, keeping a diary or a notebook of when the child is drooling, different times of the day, it might be worse, or um, are there any medical issues going on? Is it related to food? So, again, just gives us more information as a therapist when you come in with this type of concern.
Awesome. Well, thank you so much for joining me on the podcast today to answer this question and really shed some light on this whole topic that is so common, right? But it's not something that, a medical doctor or other practitioners, medical practitioners, maybe may not be fully aware of some of the techniques that you all use in working through these issues of mouth tone and saliva drooling and all that stuff. So great. Thank you so much for joining me today.
You're welcome. Thank you so
Yeah.
much.
Yes, and to our listeners, keep sending those questions in. It is, again, truly driving what we do here on the podcast. We love getting your questions. You can send us an email at downsyndromecenter@chp.edu. And I do read each and every one of the emails and do our best to try to get speakers like today to be able to answer the question for you from an expert perspective. And for those of you who would like to donate to what we do here at the center, including this podcast, you can go to givetochildrens.org/Down Syndrome Center. But until next time, bye bye.